Hello, hi, it's Dr. Erica. Thank you for joining me. Today, I am going to talk about recovery and detoxification, which entails usually a rehab type program for patients who are recently dealing with potential for medication overdose with opioid prescription therapy, which may include like your hydrocodone and your hydrocodone products. I'm sorry, hydrocodone products like your Norco. All those type products can cause potential for overdose and dependence and psychological and physiological dependence. So therefore, it is best to go through a type of recovery or detoxification program that is local and has consultation and counseling, and also has drug testing and pregnancy testing, and also can help patients by giving them prescription medications to help offset the effects of withdrawal from opioid therapy. And so therefore I'm going over that today in this particular video. So please stay to the end, like, share, and subscribe to my channel. I'm Dr. Erica, pharmacist for close to 10 years, and this is a topic of very important topic. And I also talk about symptoms to look out for in another video that you can also watch. So do please look out for that. And also feel free to binge on any of my videos that are free and open. And they talk about medications, primarily how to use medications, side effects, drug interactions, therefore benefits. And so please take that time to do that. I am going to talk about in this particular video opioid or medication recovery or detoxification. Detoxification, again, usually takes a professional team of healthcare providers and counselors, nurses, pharmacists to help each individual reach their most potential and get through the stage of recovery and setbacks, also to help move them forward to a better quality of life and a better means of life. Through the program, usually patients can receive not only counseling, but also employment, health, housing, aid, also financial aid at sometimes, and also they can receive therapy if needed to talk with someone about what they're going through and how best to get them through the program. I have been with one of the local facilities here, a pharmacist for a recovery group. And so I have had firsthand to see how patients actually go through the program and what they experience, what their lifestyles are like at home versus out in the public versus in the facility. So I have had that experience. And so I was able to dispense a recovery medication to help offset, again, symptoms of withdrawal and cravings. And that medication was methadone 10 milligram. And it is very, very controlled. That means it's held to the highest extent through the DEA and FDA, who all those official entities help to provide particular control for this particular methadone prescription. And so I have to follow all set rules and guidelines and policies. And so I had to make sure the counts were correct, that patients were getting accurate counts and dosing, and nurses also were very important, playing a role in helping with that as well, because I was a one-man team at one point, and so the nurses would come in and help with that. So I'm going to talk about how they also dispense the methadone to the patients and at right there in the facility, and help to dispense medications for take-home purposes when they needed to get their therapy when they're not at the facility. So they have to patients have to qualify. They have to be clean. They have to be set free from all previous drug use. And also they have to be alcohol free. They also have to be, when at the facility, alcohol free, drug free. They have to pass all their examinations, and they have to be willing and able to comprehend and understand the program, the rules, responsibilities, therefore. So once that also occurs, And of course, the program, these programs are usually not free, so patients do have to pay a small fee to participate in the program and get their pay for their medications and so forth. Okay, so I dispense methadone. Methadone is a controlled opioid therapy, and it comes in 10 milligram, 5 milligram, and 40 milligram, and it has side effects of drowsiness, anxiety, and it interacts with a lot of other medications too. A certain type of biological biological substrate called cytochrome 3A4 and cytochrome 2D6 as well, which is very particular to um, educational level healthcare providers. But again, this medication does interact in lay terms and interact with other prescriptions as well. So dosing is like every 3 to 6 hours, and the patient can be dosed throughout the week, depending on how intense their symptoms are, how intense their cravings are. They can be dosed once a day or twice a day. They can be dosed several times throughout the week, or maybe a few times throughout the week, on weekends, on weekdays as well. And then also they can choose to have their medications taken at home or taken in the office in front of nursing staff. And then there are uh, there are advices or advice to have patients to take methadone with a meal or without a meal. Avoid alcohol use. Okay, and the prescription cannot be refilled. New prescriptions have to be actually uh, given at the given to the patient when rendered for a prescription itself. Okay, and the tablets are only to be taken these dissolved tablets that I would give, but usually the tablets can be dry tablets that can be swallowed or followed by a few ounces of water or a few ounces of Coke. But usually we would give out personally. We would give out. I would give out the dissolved tablets, which meaning they can be dissolved in a liquid and then taken that way in front of the staff to make sure that they're being properly consumed. Okay, may cause drowsiness. If a dose is missed, skip it and then take it at the next normal dosing schedule. So, or return to the normal dosing schedule. If a tablet is forgotten to be taken, just skip it altogether, is what I should say, or what I'm trying to relay. Also, before operating heavy machinery and like vehicles or working machinery, do be advised that you monitor yourself and know exactly how you feel with this medication in the system. Over time, you'll learn how this medication works with your body and how your body responds to this particular medication. So do be aware of that when you're in the detox program. Also, you might feel a side effect of increased heart rate or change in the heartbeat or rhythm of the heart. So do be aware of that as well. And that rhythm side effect occurs when there's at least 400 milligram of the methadone in the body. There's side effects of lightheadedness, nausea, vomiting, and sweating as well. Also, dizziness can be a side effect. It does have this methadone does have histamine releasing effects as well, so do be aware of that. And this medication acts in the central nervous system. So also look for signs of anxiety, signs of drowsiness as well. And then also patients who are pregnant or think they may be pregnant need to take a pregnancy test before taking a dose of this particular medication, just to be sure that the medication is not adversely going to affect unborn child or the mother. So do be aware of that. And usually the recovery or detox facility will have pregnancy tests scheduled at regular times. And also they'll also do blood tests to test um, other diseases and infectious entities as well for all males and females periodically. So do be aware of that. And your counselor or your nurse staff will actually be helping you to determine your appropriate appointment dates to have those blood tests drawn. And they'll keep record of those results and lab work to determine your next available detox dosing of methadone. So do understand and stay in the know about your the patient's particular schedule. Also, if I may say, that it's best to be consistent with the scheduling of getting your methadone. Also, it's best to avoid triggers that may trigger an offset the effect of taking your methadone and keeping compliant and making sure that you are able to recover completely and on a timely manner so that you can live a better quality of life. Some patients may not actually recover as quickly as they would like because of withdrawal effects or relapse. So it is best to seek the attention of family and friends who you can trust and confide in completely to work with you and talk with you about being on track and staying abrupt on your methadone and not relapsing. Also, talk with the pharmacist, build relationships with the physicians and the nurses in the facility as well. That is my recommendation to come off and detox within a timely time frame. Give yourself a plan. Sit down, make a plan for yourself. Say, I want to be completely detoxed and recovered in, say, 1 year, 2 years. I completely want to be completely healed and completely normal with from this particular addiction within you fill in the blank. You determine for yourself what that plan is. Okay. So again, I was privileged to have been a part of the team, and it is something that is rewarding and to experience in the 2 months time that I was there with the facility. So I do recommend recovery and detox for anyone who may be going through opioid psychological or physiological dependence. Okay. If you have any questions or comments, please let me know and subscribe to this channel. I'm Dr. Erica. Thank you for joining me for this particular topic, and I hope to see you on the next video. Bye-bye.